we'll call the meeting to order. Can I get a motion to approve the previous meeting minutes? Motion by Brian, second by Gary, all in favor? Any opposed? Moving on to current business. Number one, authorizing an agreement with the New York State Department of Health regarding the HIV/AIDS surveillance activities. Snyder, how are you?
So, hi, Pat Snyder here.
any-
Dr. Whalen is on vacation, so she's not here tonight. I have Meredith Miller, Assistant Commissioner for Health, with me as well.
How are you? Thanks for coming.
So this is a request to renew a contract that we have with New York State Department of Health HIV surveillance. The contract period would be from January 16 to December of 2019. It's a renewal. We started this agreement with them back in 2012. The amount for the full term of the contract could be up to $400,000. In this case, we are part of the HIV program where we review records on behalf of New York State, reports, we report back to them, we visit providers, and we gather information on behalf of New York State for the HIV program. Again, this is something we've done for several years now.
I know most of them. Go ahead, Gary.
This is coming out of a grant that you get from the state, overall grant.
Yes.
This is $25,000 coming out of the grant, you're moving into your, you plant ones into your personal line, is that what you're doing?
No, we pay, in this particular situation, we review records, and for every record that we review, we get paid a fee, $200.
From the state?
From New York State,
Oh.
yes.
Okay, so
Yeah.
$25,000 is coming from,
That, I think that is
Where's
the
that
next
coming
one up, that is for the epidemiologist budget transfer, maybe?
This is
That's
for,
$25,000.
this is for up to 400,000.
This is in the wrong place.
We have another request for $25,000
That's
for
the
a budget
one I'm looking at.
reallocation, yeah.
But look at,
Oh, yeah.
that's, I know this is right, but is that?
I apologize, they may be out of order, I'm not sure what you have. Okay, all right, sorry,
so it's 100% state money.
correct.
Motion moved.
Okay, any other questions? Did you? Okay, motion by Gary, second by Joanne. All in favor?
Aye.
Any opposed? Thank you.
Thank you.
Number two, amending the 2016 Health Department budget, administrative adjustments.
So this is a request to reallocate funds, it's budget
Okay.
neutral, from, in order to facilitate a epidemiologist services in our part-time line. We had a full-time epidemiologist who retired at the end of October in 2015. We had expected and had hoped to be able to fill that position with another full-time person. We've been unable to do that. It's just a question of finding the right candidate for the position, and we've been struggling and challenged to do that. But in the meantime, as you probably have read in the paper and a lot of other publications, there's a lot of issues going on out there, not the least of which is Zika. So we still need the services of an epidemiologist, and we've been paying this person out of our part-time line, which is where we had originally hoped to have her just on a temporary basis. So here we are in June, we still need to have the services of this person, and we're asking to reallocate some funds to continue to fund that line for the rest of the year. We still hope to find a full-time epidemiologist, but in the interim, we need to be able to have the services of someone who is very familiar with our department, who's worked there for many years, and continue to employ her and pay her out of that line.
Thank you. Any quick, Brian?
You don't expect to find a full-time replacement before the end of the year?
Well, we are hoping to find a full-time replacement. We've interviewed many candidates. They come with various degrees of experience and willingness to maybe relocate in the event that they have to take a civil service test. So there are some challenges that we have to get through in order to find the right candidate who has the skill set that we're looking for and we need to address the concerns that we have.
So we should be able to reallocate these funds back to the other line if you hire somebody in, say, a month?
Yes.
Okay.
Yes.
Joanne?
Is this the only epidemiologist that the health department has in its employ?
Yes.
Kind of amazing, given the responsibilities of that function.
It is, it requires a lot of experience, there's a good deal of responsibility, as you know, that goes with it. And we are very fortunate to have somebody who has a good deal of experience and is a recognized leader in the field. So we have been able, fortunately, to continue to use her.
Yeah, I would agree with Joanne. Maybe in the future, we could have some kind of contingency plan so that we're not caught short again, having to rely on a former retiree to come back.
I agree.
Gary?
So, $25,000 is coming out, so we contract out with these doctors? And
Well, we're paying her on an hourly basis.
it's not a county employee?
Former county employee.
She was a county employee.
Because you're taking your money out of your fees for services, and I'm trying to understand where the $25,000 is coming from. If it's not a contract employee, then what, then where are the fees coming from? What are
We
you
had
paying?
some flexibility in that particular budget line as a result of some revenue that we were able to claim from other resources. So some of which involved COLA money for immunization and other epidemiology and chronic and disease-related efforts. So we felt that this was an appropriate use of that money to at least temporarily be able to use it for the epidemiologist position.
So you received $25,000 additional revenue this year,
Right, we brought it here, yeah,
and this is how it's being allocated.
yes.
How much more revenue have you received this year?
In that, from those resources,
In your whole department? That you, that's not budgeted?
about 75,000. It was from COLA, this was COLA money that was allocated after the budget was approved last year. We were awarded the money in March. We brought it here to this committee because we had to do a budget amendment to accept the funds.
So where's that $75,000 now in your budget?
It's in the
Fees for services?
Yes, yes.
It really shouldn't be there. It should be in a revenue line somewhere, not fees for services. All right, thank you.
Okay.
Brian?
Can I follow up on Gary's point quickly? So 75,000 extra revenue this year, and we're taking 25 out for this. So we'll have at least 50 in extra revenue.
Well, it's there for, yes, unanticipated. In this case, it was an unanticipated expense.
Okay, thanks.
Okay, any other questions at this time on this agenda item?
Yes.
Wanda?
She still live in Albany County? The individual still live in Albany County?
No, she doesn't. She started with us about 10 years ago, and she's a per diem employee. She lives in Columbia County. And we have another individual who is also going to come on board, who lives in Albany County, who's an epidemiologist, so we'll have two.
Okay, so this individual is a, if I can get this straight, she's a retiree. So she was a county employee?
Yes,
So she was a member of the New York State Employees and Local Retirement System?
yes.
Okay, so she retired from the county. She's collecting her pension. She no longer, was she in Albany County, or she no longer lives in Albany?
No, she never lived in Albany.
Oh, she never
We
lived
had
in Albany.
a waiver for her when we initially hired her.
All right, so, but she's only gonna be paid $25,000, and she can make 30, so it wouldn't make any difference.
She works about 1 to 2 days a week, and then the other individual we'll be hiring will also work 1 day a week, so the equivalent.
So they're under the $30,000
Yes.
cap for retirees who are
Correct.
returning to public employment.
Exactly, yes.
Okay, any other questions? Get a motion to move? Motion by Brian, second by Joanne, all in favor? Any opposed?
Yes.
Thank you.
Number 3, amending resolution number 157 for 2016 regarding additional funding for the Addictions Care Center of Albany and amending the 2016 Mental Health Department budget. Giordano,
Good evening.
how are you?
Very well, thank you. So this first item is, as you say, an amendment to the 2016 budget with a resolution 157. This is 100% state aid funding from the Office of Alcoholism and Substance Abuse Services to the Addictions Care Center of Albany, who has a new location on Broadway in Manans, and the state has decided to give them money for the $76,000 for IT infrastructure and fire insurance costs. These are operational monies that all of the OASIS programs typically get, but since this is a new location, new program, this was a kind of like an add-on from the state. So again, it's 100% pass-through for them.
Any questions from the committee? Wanda?
Okay, when you say it's a new, is this an additional program? And let me clarify what
Sure.
you're saying. I see here that address is 90 McCarty Avenue.
That's their main address.
That's their main address.
Correct.
So this is an office that they're opening in Manans,
It was opened earlier this year
opened earlier this year?
on Broadway in Manans.
Okay, on Broadway in Manans. So, and this $76,000 is for,
Well, they're calling it IT infrastructure. What I'm told is that this is to wire them and to hook their electronic health record up, and the fire insurance costs are just part of the cost of doing business, apparently.
so this is for the infrastructure itself as far as this building is concerned?
Correct.
Okay.
Brian?
Random question, I mean, I certainly appreciate the need for those costs and those expenses, but I wonder if we're satisfied with the overall performance of this vendor in the program, and
Yeah.
whether this money might be better spent on actual direct services.
Yeah.
Is it necessary for us to, pass through the state money for these infrastructure costs, rather than direct services?
So it's kind of a complicated question. I'll do my best. Addiction Care Center of Albany is one of our longest-standing partners in the drug and alcohol treatment field. They have a litany of services in the community. We monitor those contracts pretty carefully, and we don't have any problems with the provision of their service at this point. So I would say that, this money will allow this program to continue in its new location, and the service that's provided there is quite exceptional.
Is it required that the state money go to,
The
Basic
state is,
infrastructure
the
costs like
state
this?
is giving it to them
okay.
for this purpose.
I mean, did the state sign off on this or for infrastructure costs, or is
Oh,
it just
yeah.
an overall program
No,
increase?
this is, last year when we came with all of our contracts, as we often do, this wasn't included in it because the new location incurred these costs since that time. So this exact amount for this exact purpose came to us in a state aid letter from OASIS for this singular purpose. So if we were to say we don't believe this provider deserved it, they would take it back, and we don't have the authority to decide where we want to put it elsewhere.
Okay. I guess it's more of a complaint to the state, but I find it a little hard to believe they opened this new facility without fire insurance cost and IT costs factored in. I would rather see this money going to direct services, but if it's state earmark money, if it's not a heck of a lot we can do.
Yeah, I understand your concern. OASIS in particular will amend their state aid letter multiple times over the year
Right.
as they kind of catch up on these items.
Right. Okay, thanks.
Any other questions, Gary?
I have a question, Addiction Care Centers of Albany.
Yes, sir.
Now, will they get involved with gambling problems? Because that's gonna be a new,
Yeah.
will be handed in January?
Yeah, so there is a licensed program in Albany that specializes in problem gambling, and, but all of our addiction programs screen for problem gambling and treat problem gambling if it's part of another addiction. The capital area, there's another program that only treats problem gambling in the community.
So we have people
Yes, we do.
available to do that. Now, are we accessing the funds available from the state for that?
That's
It's my understanding with the legislation that we passed, there's a part for gamblers anonymous and gambling addictions, and there's some monies out there.
Yeah, I'll make sure we look at that. I don't know the answer to that right now.
Okay, good, yeah. I mean, it's part of the whole, you won't say anything to let it open,
Well, but it already,
but it's part of the whole program.
It is, and there are already many people in this community who are struggling with gambling addiction, and many of them are receiving services. But you're right, the first thing that we thought when we heard about the new casinos and everything was business is gonna, unfortunately for us, boom. It's not a good thing.
Typically, it doubles.
Yeah,
That's what it's done in other casinos
yeah.
in areas where they opened. So,
Wanda?
Okay, all right, so what I've noticed here, this is something that, it says the program's unfunded.
Right. So this is an outpatient clinic, and its revenues are totally driven by insurance and Medicaid. So this money that's going is for operational costs, for brick and mortar, for hardwiring it, and as opposed to some of their other programs that don't derive a revenue, where the state does put actual.
So if I'm to understand this then,
Yes.
this is something that the Addictions Care Center has applied to New York State,
Yes. that's
okay?
correct.
And they were to pass through for these dollars for the IT infrastructure and also to, get this built in the IT.
Yes, that's correct.
So that they can, provide these services and receive these people, patients, clients.
That is correct.
paid through.
It's in
Okay.
addition to, the previous resolution was $832,000 that goes to this set of programs. This is an addition to that.
Thanks. Any other questions? Can I get a motion to move? Gary? Second by Brian. All in favor? Any opposed?
Aye.
Thanks. Unanimous. Number 4, amending resolution number 201, 2016 regarding additional funding for the Department for Children, Youth and Families and amending the 2016 Mental Health Department budget. Yeah.
So this also is 100% state aid pass-through money, but this time it's from the New York State Office of Mental Health. The recipient is the Department for Children, Youth and Families, who, as you know, operates the mental health services for children in this county. The previous resolution, 201, was for $385,000. This is an addition of $19,000 for a very particular purpose, and that's just for the service of case management services for children who are not eligible for Medicaid. And the percentage of children that fall into that category is over 40% of the kids that are served in this program. And just as a counterpoint, in the adult side, we have a similar case management program. That number is 3%. The rest is Medicaid reimbursable. So what the state has decided here is that in order to make this program whole, they were going to supplement them with $19,000 to provide services for kids that they couldn't bill Medicaid for.
Okay. The 19 makes it whole, or is that just
The
a fraction
19,
of it?
well, it's estimated that the 19 will make it whole.
Any questions from the committee? Hearing none, can I get a motion to move? By Brian, second by Wanda, all in favor? Any opposed? Number 5, amending resolution number 499 for 2015 regarding additional funding for rehabilitation support services and amending the 2016 mental health department budget.
Right, so this too is 100% state aid funding from Office of Mental Health, but there's a little different twist to this. So this amends a resolution 499 from last year. We're asking as well to enter into contract with this program to provide a very unique service. So if I could, just for a moment, a little of the backstory. CDPC is a state-operated psychiatric center in this county. It's a blessing and a curse. It serves 9 counties. We incur a lot of the work that occurs when those people come back into the community. The state is once again downsizing its state psychiatric centers. They have a goal of reducing the census at this hospital by another 20 to 30% in the coming 2 to 3 years.
Hey, his father did it.
It's been going on for a long time, and it certainly puts a pressure on the community. The Office of Mental Health awarded $230,000 to this county to develop what they're calling an outreach team, whose sole purpose will be to work with the hospital to move people from hospital units into residential programs in the community. The criteria are people who have been there for more than a year and have been difficult to place. We issued an RFP, number 65, earlier this year. The criteria for responding was experience with residential provision of services for mentally ill people. We had one responder, that was RSS, and we reviewed the RFP and we decided that it met the qualifications. So we hope that we can enter into contract with them.
Wanda?
Yes. Okay, so it says, I'm just reading the justification
Sure.
here. So it says, since 2014, Albany County has been awarded $195,480 more.
That's I think, I'm sorry to interrupt you, I believe that's the next one.
Oh, I thought we were on 5.
No, I think, that's the reentry one that you're
I'm
talking?
sorry, you're absolutely right. You're absolutely correct. Okay, we're on the rehabilitation
Yes.
support services. My, incorrect.
Another question?
I thought we were on 5.
Does anybody have any questions on agenda number 5? Gary?
I just want to follow up. So you're saying that the state, with the CPC Center in Albany, in our neighborhood,
Yeah.
is going to reduce their intake by 30%?
What did you say, intake?
Well,
No,
you're
no.
saying they're reducing,
Right, they're inpatient
so
census.
they're gonna kick people out too?
Well, I wouldn't use that phrase.
What would you call it?
Reduce the need.
They're reintegrating people back into the community. And they're asking community resources to pick that burden up. And this is not new, as you said before, there's certainly precedent in different state administrations, but this goes back to the deinstitutionalization of the 60s and 70s. But their census numbers have been reduced once again. I'm told they have about 100 patients left in that hospital. At its heyday, it had many hundreds more, and their goal is to remove or reintegrate 30 people back into the community. And
So they're gonna be down to 70 in there.
at the end of the 3-year period.
So if someone has a mental health issue with our crisis, a mobile
They're-
crisis center, and they need to go to there,
Right, so
They're
they're
gonna
not,
close?
they're not stopping admissions. There's short-term in and out all the time, and that will continue.
Oh, okay.
This 30 is identified as being there for more than a year, and they each have individual challenges to being reintegrated in the community. So the hope is that those folks will lower the census to 70, but that 70 will be fluid. Most people don't stay there for
Right,
that long.
right, right.
So, your instinct is right, but I don't think it's as bad as there'll still be access to hospital services, and also Albany Medical Center, which has an inpatient psychiatric short-term unit.
well, I don't know how much time you spend in Albany. If you drive around the city, or now even in the colonnade, all these homeless people, and all these guys out there begging for money on the corners, have issues and have problems.
Yep.
And this is where it comes from.
For
Because they're-
some of them it's addiction, some of them it's mental illness.
And some of them, it's a business. But, it's a problem.
Understood.
And I'm sad to hear that, a Democrat governor is doing something
Well,
like this.
that's been statewide, that's the developmental disability centers. They closed the developmental disability center in Schenectady. And all the state psychiatrics,
Yeah.
all the state psychiatric centers have been given the same mandate. So doesn't make it any better, but we're not unique in that.
Oh, no, I'm not saying he's singling over the county out, but I'm just saying, it's, I just think my philosophy as a Democrat and his obviously are different.
In another setting, I would probably agree more vociferously with you. In another setting, I would probably agree more.
Joanne?
But these funds are for rehab support services. So are these individuals who are transitioning back to the community? Do they have housing?
Well, that's actually, this is the intent, the
This is
specific
the
intent.
housing?
This is the outreach team that will work with them for 6 to 9 months while they're in the hospital. Will develop housing opportunities that are unique to their needs in the community, And then, really, this is a hand-holding project of getting those people
Right.
into housing resources.
Right, but I think part of the problem with this whole deinstitutionalization movement, whether you're moving the mental health population or the behavioral health or the developmentally disabled, is that you've got to, while you're downsizing on the institution side, you've got to grow the home and community side. And I'll tell you right now, that's not happening as a policy change in the state of New York. So I would encourage us to, try and think creatively
Yeah.
about how we're gonna be prepared to catch these
Yeah.
people, because otherwise they do end up on the street,
Yeah.
and they're pushing on, on creating problems in other, community-based programs.
This is state
One-
control, we
one-
don't have any control over it.
Yeah.
But
I
on-
mean-
once again, if I could, I would just say that, your instinct is correct on this, and I agree with you. This is the challenge that we have at the county to deal with the community resources. So we, right now, oversee providers of housing resources. We're following about 800 to 900 individuals who are in disability housing, and it's not enough.
Right.
And so we can have another discussion at some other point, but we have advocated numerous times with OMH about this, and we make very small gains, but we're still fighting the battle.
We have 900?
We
900
have
people
nine-
in housing in Albany County?
900 who are in disability-related housing, either mental health, and
Those
quite
are
frankly,
Did you say
Homes and-
mental health? I'm trying to hear what you said. 900?
disability,
You said disability, then I heard you say mental
Develop-
health, but
mental-
what's in between that?
I don't think it was anything important. It was developmental disability and mental health I was including in that group. And we hit the tip of the iceberg. We have ended up treating the most severe and persistent and acute, but there are many people out there who are not that yet. And, but this is a national problem as well.
Do we know what the percentages, or just a rough ballpark, if we even know, of Albany County residents versus those residents from out of county that reside at CDPC?
I have often tried to get that information. There's 3 disability areas: developmental disability, addiction, and mental health. The data streams are separate. When you have a county that has a state psychiatric center and all these addiction programs, many people get discharged, not back to their homes where they had the problems, but into our community,
Right.
and they become residents. I can try to work those numbers again for
I
you,
was
but,
curious if you knew.
well, it is more than if we didn't have the psychiatric center here.
Wanda, did you have a question? I'm sorry.
Yes. Now, you're saying they're coming from a specific hospital, is that right?
For this particular CDPC,
Okay, so they come from, okay, good. All right, so they come from CDPC, and so they now have become more or less the clients of the Rehabilitation Support Services.
or Equinox, that's the other big provider.
Okay, so you said they had 100,
They have 100
they have 100, but you said 30
over the next 3 years.
over 30 over the next 3 years will be reintegrated into.
Yes, the goals for this program are 8 a year,
Eight, okay.
8 patients a year.
Okay, so now with that, okay, is there some kind of way in trying to address what my colleague has just spoken about, so that we're tracking where these people are going? Because I see them in my community, in the area that I serve a lot, okay? And it's, I try to engage them in conversation without being, so invasive into their, privacy, okay? At the same time, I'm trying to find out if they need any help, all right? But I'm in agreement with her 150%. We need to do something, we need to be hopefully tracking these people more. So what I would like to know, this money is going to, you said Equinox, and what happens to these 30 people?
Right.
And you said it's, I can only use the 30 people right now. These 30 people, and when do they drop off
Yeah,
the list?
yeah,
Okay, so that, that number is just going to keep growing.
yeah.
You know, when you talk about 80 a year, I'm just wondering for the people who don't wind up in these services.
Right, no, I understand what you're saying. So the pool, the candidate pool, are people who've been in the hospital for more than a year. They're not those people that you're seeing. I think that it's a separate issue and a separate problem, but it's related, obviously. The sad part about all this, to be honest with you, is because we're only treating the serious and acute patients, your services have been limited at every level. We've stayed pretty much, thanks to you, level for the last 5 or 6 years. Folks that you see on the street, they have to get sicker before they can get into the hospital. And then once they get in the hospital, we have to try to get them out. It's a system that is very challenging for us as well. And I will just tell you, if I could add one more comment, you see a lot of people on the street, we see a lot of people who are quietly suffering in their apartments that are also in trouble. And we're trying to, meet the need as best we can. We have 76 individual contracts with local providers across all the disability areas. We're serving ourselves. Last year we touched over 2,000 lives in all of our different programs. Tip of the iceberg still.
Can I have one
Sure.
One additional comment. I would just say that maybe at a future meeting or discussion, it would be really helpful to understand what the totality of the effect has been, not just on the behavioral health side, mental health side, but also in the DD population of this push out to community, because I think we as a health committee should understand that and also should advocate to the governor's office and the state legislature if there's a need now on the community-based side that we're not meeting. And it would just be helpful to understand sort of the ripple effect and, as a policy recommendation, perhaps say, pushing people into community is a great goal, but it doesn't always work unless you've constructed a very robust community system to catch these people and provide services.
I agree 100%, and I appreciate the comment.
Thanks. Can we get a motion to approve by Gary?
Right, CDPC, how much of an area do they cover? They were
9 counties.
9 counties. So we get the double win, we're cursed for having Albany Med here, but yet we need it.
Well, the
It's
drug
great.
programs too, people come up from New York City, for example, and their discharge is to not go home, because that's where their problem was.
Yeah, that's my point.
Our population of disabled folks grows because we have so much. You build it, they will come. That's unfortunately the.
Thank you.
Thanks. Can I get a motion to approve number 5 by Joanne, second by Brian, all in favor? Any opposed? Thanks. Going into Bob Bessie's Personnel Committee time, so I'll have to expedite the next 3. Number 6, authorizing an agreement with the New York State Division of Criminal Justice Services regarding the Reentry Task Force Program.
Right, I'll try to be brief. So many of you in this committee know that and have authorized our reentry task force. We are one of 19 counties across the state. We're just finishing our 2nd year of a 3-year contract with DCJS. Our performance targets have been hit each year. We just finished our last year. We served 245 returning citizens from state prison. Our targets are about getting them back, folks to work, engaging them over 45 to 90 days. What the state did, again, this is 100% state funding, they brought in new players in addition to the 19 counties. They want to sync up all of their contracts across the state. So we just finished year 2. They want to extend year 2 for 3 months and then start year 3 for all the reentry programs across the state in October. So this is a request to add $48,960 as a 3-month extension to a fully 100% funded DCJS 3-year grant, which is something we're very proud of in Mental Health Department. And if any of you have seen or heard about it, I hope you are too. We serve a lot of people, and I think we're doing good work here.
Any questions from the committee? Brian? A motion by Brian, second by Joanne. All in favor?
Can I ask you one?
Sure.
I'm sorry, that's one of the. Can you tell me, I see here that we pay a reentry coordinator $95,000 a year?
Salary plus fringe. So it's a third of that or more is fringe,
Oh, a third.
or more.
Oh, okay. All right.
Motion by Brian, second by Joanne. All in favor?
Aye.
Any opposed?
Thank you all very much.
Thank you, Dr. Giordano. Number 7, authorizing agreement with the Albany Medical Center Hospital regarding morgue and laboratory services.
Tim, yeah.
Table this?
County exec has some questions.
Yes, sir.
Anybody have any questions? We had 2 proposals submitted, one for Nellis, one for Albany Med. As everybody knows, the past bunch of years, everybody's been complaining about Albany Med, their rates, what they pay. Ellis has submitted a lower one for $700, but that's only 1 week out of the month. There's a chance where we could save $160 per case 1 week out of the month. Albany Med's proposal is $860 per case. I feel as if we should act on both of these proposals. Along with Dr. Hubbard here, is one of the pathologists in the coroner's office. I brought him along if anybody's got any questions.
Mark?
There are different rates between Albany Med and Ellis,
Correct.
but the reason why Ellis is not available as much, is that what,
Correct.
otherwise we would go with Ellis because they're cheaper.
Their facility, I don't believe can handle all our cases, where Albany Med is a lot bigger. The other situation we have is Dr. Ng, who's one of our pathologists, is the head of pathology out at Ellis. It would be a lot easier when the week that he's on, once a month, we do them out at Ellis for him.
All right.
That's
So
the difference.
it's a capacity issue, that Ellis isn't capable of all of them, but it does make sense to do some of them because it's cheaper than Albany Med.
Correct, correct. And, you know, everybody over the years, I've been doing this 29 years this year, everybody always complains that Albany Med is the only one that ever bids on this. Here's a chance where we can go out there, at least try it.
Thank you.
1 week a month. Gary, you're one of the ones that always,
Well, I got a real problem with Albany Med. I mean, Albany Med sucks Albany, the city, dry.
I understand that.
And,
I-
and it's a real concern for me. And,
They've been the only game in town for years.
well, Ellis is playing ball now too. I don't know why we're only doing 1 day of 1 week. We should at least talk to Albany Med and negotiate with them more than what they're paying. Besides $860 more, you're looking at the fees that they do for the services.
For the services.
That's where the money's at, you know,
Right.
that's where we're spending our money. And I just think we spend an awful lot of money for Albany Med. And I think it's over $250,000, $300,000 in the budget, something like that.
No, we budget 190 for more use.
Well, if you did just simple math, 860 times 250, that's $200,000 right there. 250 plus per year you do. So, unless I'm looking at your numbers wrong, I'm not
You know,
getting it right.
depending on the volume, some years we could do 250, other years we could do 220. You know.
Exactly, but I'm just saying, Albany Med flies them in from all over the Northeast, and they bring them here, they die, unfortunately, and we have to do the autopsy.
We're fortunate, we've got a trauma center here,
Yeah.
but that's
Well,
one of the downfalls.
We are, that's the
And
downside to it. And
that's-
the downside to it is very costly to the taxpayers of Albany
I
County.
agree with you 100%.
And there's, something's gotta be done with Albany Med for, I'm sure they're billing those people for those helicopter rides.
Oh, yes.
And, you know, why can't we get monies from Albany Med, from the insurance companies or builder insurance companies for these autopsies?
There's a copy of the state law.
I saw it.
Okay, I just
So,
don't like what you saw.
at least Albany Med should come to the table, sit down with us, negotiate with the county executive. I believe we have a resolution in
We
requesting
do,
that.
we do it in
that-
March, yeah.
That, they sit down and talk with us about this. Because, you know, I mean, even though they get a pilot agreement with the city, Albany County gets nothing.
I
They get
understand that.
nothing out of that pilot agreement for the county of Albany. And I just think that Albany, and these fees have been going up and up and up, as you know, every year.
We've discussed this 5 years ago when I was
Yeah.
here in regards to this.
Longer than that.
No, longer
Phil
than that.
Fury used to discuss it with me.
Right.
That's how
So,
far back it goes.
it goes way back. So no one's been doing anything the past 5 years. Now the contract has expired the 31st of May, so we're working without a contract. And now all of a sudden, we want to start negotiating. How come it hasn't been done prior to all this?
Why are we doing a 5-year contract?
Let's do a 1 year.
I would
Do a
absolutely
6
feel
month.
much
Let's do 6
comfortable
month
with
for
a
now.
1-year
Well,
contract.
We may not be doing anything because we haven't negotiated it yet either.
Well,
so-
we're gonna table this in.
So,
Until we
I
see
got a
what
quick
we're
question for you,
negotiating
Tim,
about.
before we do table it, and we do have to ask the county exec staff too, some questions about the negotiation process, but the Ellis proposal, they offered Ellis proposes to provide coverage for Albany County for $700 per case. The expense of Ellis providing such services is $115 per case, $115. Is that $115 included in that 700?
Yes, it is.
Okay.
Yeah, I verified that today. That's what it's costing them for the morgue attendant per case. That's what
Okay.
that's what Ellis is saying it's costing them. So their rate is $700. You know, if you're gonna table this, if we're already working without a contract with Albany Med, why can't we do work without a contract or a month-by-month contract with Ellis for the,
We can't because we're extending, essentially
month
we're
or two at a
extending the
time.
Albany contract.
Yeah,
It's different.
and
Yeah, you're,
Wait, say that again?
We're extending on a month-to-month basis an existing contract with Albany Med. We have no contract with Ellis at the present time, so there's nothing to extend.
yeah, and the negotiation Gary references too was Resolution 124, introduced in March of 2016, requesting the county executive to negotiate with the Albany Medical Center regarding the charges for autopsies. I think you all have a copy of that. Would anybody from the county exec staff like to comment on the progress of that?
Sure. My name is George Penn.
Hey, John.
I have been speaking with the Albany Medical Center Law Department. They have a copy of that resolution. They're reviewing it. And right now, we've been, trading phone calls and emails, trying to schedule a date to get together and go over the resolution and start a negotiation.
Okay, is there any questions for Tim or George? Brian?
And more of a comment, I might suggest the county attorney take a look into this this state comptroller opinion. One, because it's pretty dated, it looks like it's the mid-60s, and also it is not case law, it's only a comptroller's opinion, so maybe there's some room to possibly revisit that issue. But we're not entirely bound by a state comptroller's opinion as we would be by case law.
Joanne?
Maybe this is obvious to everyone else, but St. Peter's,
Try once
you
more.
bid?
not interested.
Okay, and then my other question is, I definitely think this multi-year contract is a little problematic. I also don't know for the following year, from June 1st, 2017 through 2018, I don't know what the increase would be. What is the average of the hospital OPCPI for the previous year? So that seems like we should at least know the ballpark range of what that would be. But
On
I
the
also-
average, it's been $30, $40 per case.
Okay. But I also think that maybe the way to go is not a multi-year, but rather a year.
Any other questions from the committee? Gary?
what would happen if Albany Med brings one of their patients in, flies them in, and we don't pay for the autopsy? They send us a bill and say, wait a minute, it's not an Albany County resident, we're not paying. What are you gonna do?
Well, right now, they'd probably
Can't
sue
answer
us
that.
under the contract.
Oh, we don't have a contract,
Well, if
we're
we,
going month to month.
but still, the contract itself is extended, the actual contract is extended on a month-to-month basis. So the terms of the contract would be still active if we
So
extended it
when
a
you're
month-to-month.
negotiating with those attorneys at Albany Med, you got to find a way, a mechanism to bill non-Albany County residents. And up to Albany County residents with insurance, that there's gotta be a way for Albany County to get the billing through the insurance. I mean, you know, we set that up. We have an ambulance service now in Albany County. We have our own county ambulance service. We can use them as a biller. We can bill them through them.
Gary, could Dr. Harvard answer some of that for you?
There is no insurance company in the country that will give you a penny for an autopsy anywhere.
They don't pay.
They will not pay. There's nowhere to send the bill.
The
But
state,
they will not, well, that, you need an address. They will not pay.
I'm sure Albany Med has an address.
There is, well, you can bill Albany Med if you want, but there is no insurance that will ever pay for an autopsy.
Thank you, I didn't know that.
So since these negotiations are ongoing with George Penn and.
So that's why Albany Med sends it
Motion
to
to
us.
group 7 and 8, so we can table both. Get a motion to group.
So moved.
By Brian, second by Gary. Can I get a motion to table number 7 and 8 until George Penn completes his negotiation? Well, do you have a question?
Yeah, I just had a question. If we're doing the autopsies in Ellis, are we including the transportation of the body up to Ellis?
I'm sorry.
If we're doing the autopsy up at Ellis, are we including transportation of the body up to Ellis?
No, that's separate.
So that's gonna be another charge?
Also, at Albany Medical Center, I mean, when we move cases to the medical center, we pay a flat rate of $200. It would be the same. That's a separate line item.
Is that, do we bid that out?
Okay, we have a
No,
We don't bid that out?
never have. We're getting,
Doesn't mean we can't do it. 250,
no, 200.
200, and they get $200 each
What do you mean each?
every time they move
Each
it.
body. Yeah, each body.
Somebody dies out in Colony, and we're called, and it's a case that's gonna go to the hospital for an autopsy, we pay a funeral director $200 to move it.
To move it.
Hey, we're getting a deal for $200. Schenectady County, I think is paying $450. Rensselaer is higher, we're getting a deal for the flat rate of $200.
We have a motion by Brian, second by Gary, all in favor? Any opposed? We get a motion to adjourn. Gary, all in favor, by Sam, thanks.